Hey, Dr. Vicki here. So I get a lot of difficult cases. More often than not, a case will walk in and have a lot of different symptoms that a lot of times don't seem related, but are totally related. So I had a patient come in that has all kinds of issues in regards to upper back pain. She has carpal tunnel in both hands. So this is either screaming postural components, compression of the brachial plexus, possibility of compression of some nerves, but it's in both hands. So I'm going to say that it's probably more likely going to be coming from some postural component. And as it turns out, she sits at a desk all day and her hands go numb. And at the end of the day, her hands and her arms are tingling and numb. But then she also has other things that have happened that seem to be unrelated. And a lot of that is some lower back pain, cramping in the legs. So we have congestion in the area up and through here because she has a lot of swelling right back here, and her head is out here. So she's sitting at her desk like this all day. And so what happens here is stuff doesn't flow very well. When your head is cranked out here 10, 15 degrees, things don't flow from the lymphatic system here. So then that also compresses your arms. So you have carpal tunnel developing. She doesn't have a whole lot of weakness, a little bit in her fingers. And so what do you do with all of that? So you change the posture. You look at the biomechanics of her sitting at the desk, and things are happening down in the lower back as a result of all of that too. So her legs are dangling from the chair. She said she doesn't sit back in her chair. So we have to look at kind of the way she sits at her desk and try to help make some adaptations to her posture, make some adaptations to her workstation, so then she doesn't have all of these things going on. So we resolved the issue within a couple of adjustments, and that's pretty much how it goes with a lot of people that sit at a desk, that drive. All of these different things are very forward, and so then that will in turn create some problems. So if this sounds like you, give Souter Chiropractic a call, 303-385-3432 or souterchiropractic.com.